In this video, I'm presenting a diagnostic cerebral angiogram using a Siemens 2 catheter. Once we have achieved access through the right femoral artery, we navigate the wire followed by the diagnostic catheter. I like to observe the trajectory throughout the aorta and make sure that the catheter is not going into a branch, renal artery on my way up to the arch. Once we have the Siemens 2 catheter in the arch, I rotate the catheter in such a way to form a alpha sign followed by the wire to reconstitute the Siemens 2 catheter. So what I just did outside here is you're gonna see reflected here on the catheter. So I'm rotating the Siemens 2 towards me to form that alpha sign that you use looking at it right now, and then pushing the wire will give me the Siemens 2 form that is required for this catheter to maneuver. Once I have the proper Siemens 2 form, then I push the catheter and start looking for the great vessels. Here I'm trying to find the left common carotid artery first. Right now I'm in the right subclavian, and then rotating and pushing the wire out of the vessel. Then I click into the left common carotid artery, and by pulling my catheter I engage into the common carotid artery. Then I perform an angiography, in this case as a patient with severe carotid artery stenosis, as you can see here. Once I'm done with the left common carotid artery, I push the wire to get out of that vessel, and then pulling and pushing again, I trying to find the right common carotid artery. I think I'm right there. Then I just pull the catheter to engage into that common artery, perform another angiography. You can observe the severely stenotic artery. Then we do similar maneuvers to get into subclavian arteries in order to perform a vertebral artery injection and posterior circulation angiogram. So by rotating and pushing, pulling the catheter, now engaging to the left subclavian artery. In order for me to get into the vertebral, I perform a roadmap. The problem with the Siemens 2 catheter is that it is less stable than just a straight angle catheter, and you just observe how I lost the shape of the Siemens 2 catheter, but I can still use it to get into that vertebral artery. Sometimes it's difficult, especially with patients with tortuosity, so I just keep the catheter in the subclavian artery and perform a posterior circulation injection. Thank you.